Australia, 1 in 3 people have a musculoskeletal condition. As Australia's population becomes older, the burden of musculoskeletal conditions will become greater unless we can put things in place to try and reduce that burden. It's the first time that we've got this entity, this centre that spans both the University of Sydney and also Sydney Local Health District. We're working with clinicians, with patients, with policymakers in the real world. We look at traditional medical treatments such as drugs and surgery. We also look at new approaches to treatment, ways of getting therapy to people who are hard to reach or doing it in a more efficient fashion, right from little kids all the way through to older people. What we're interested in is improving musculoskeletal health and promoting physical activity, so 2 really important issues.
The Institute for Musculoskeletal Health has great potential benefits for our patients within the emergency department. Having researchers in the ED, they have a different perspective of our patients that we do as clinicians. We're always learning from each other, and they've been very proactive in coming and speaking to our clinicians and educating them. So I think it's really exciting what's happening here, because it's actually really focusing on the areas that we do every day. I think really having patients at the centre of what we do is going to make a massive difference.
As a researcher, sometimes you try to find the most relevant answer for the practice and for the district. But it's really the clinicians that ask those questions. So it's really important for researchers like myself to work with clinicians. We're doing a large implementation trial of a model of care for back pain to emergency departments. So that involves training of clinicians to provide better care for back pain.
Most recently, I've been involved with the SHAPE trial. We've developed patient education tools to help the clinicians educate the patients on what's going on with their back and how to better manage their back pain. As a clinician, I feel very lucky that I've had the opportunity to work with such experienced academics and researchers so that we can work together to make research more relevant to clinical practice.
One night I couldn't really move and I was experiencing really sharp pains in my lower back. I went to emergency, then I was referred to a physio. Every physio session I've not only been trained to work on my exercises to help strengthen my back, but I've also been taught to think in a different way. It's been such a big turning point because I can now exercise without fear. If I do feel sore afterwards, I can bounce back after a few days.
At the University of Sydney, we have a deep commitment to research excellence, and so the Institute is really critical in terms of conducting that research at the highest level. The research is really conducted in an integrated way, which means that the research questions are informed by the real-world problems. The real benefit is that the research can be then translated and have real meaningful impact on the community in a very short time frame.
So we did a clinical trial to look at the effects of paracetamol in patients with acute low back pain. What we found was paracetamol did not actually improve the recovery. That research was one of the most cited papers published in a very good journal and got picked up by a lot of major media outlets in the world. We work with expert clinicians, with interested patient groups, and also expert researchers. And that's a wonderful structure because it can help us disseminate our research findings as quickly as possible into the community.
What's wonderful about the Institute is that it's embedded within the health service to bring the very best evidence to the treatment of our patients. We also think that it will help us to be more effective in utilising the dollars that we have within health in the most wise way by investing them in interventions that are really going to make a difference.
I had an opportunity to work as a research physiotherapist on the Mountain trial, which was looking at affordable technology for people with mobility limitations to increase their physical activity and their mobility. We often worked with the physiotherapists in identifying some of their main goals and some of their impairments that we could address. The technology now that's available to really work on targeting things like standing and sit to stand and walking is really amazing and very tailored to people and their impairments, so that's really exciting for the future as well.
The Amount Rehabilitation Trial was run with 300 people and we were able to show really good improvements in people's mobility. We can help to reduce the risk of chronic diseases such as heart disease and diabetes, which are really costly to the healthcare but also to people's quality of life. We have a really strong, cohesive team of researchers here who are really passionate about what we do. And I think that really helped for the success of the trial.
When I was in the hospital on the ward there, I was very off balance. Concentration wasn't real good. When it came time to discharge me, I thought, oh, I'm going home. How am I going to get back on my feet? I took part in the Mount trial. When I got home, I had to continue on with the iPad exercise and the Xbox. I'm really pleased or proud of where I am now. I'm getting them out without the walking stick. I've gone back to all my social groups. I'm still doing my long walks, my short walks. I'm so grateful and thankful for those who had put the trial together, and also they give me the opportunity to be involved with that trial. I know when I look back, I wouldn't be where I am now.